Well, good afternoon, everyone. Let's get started. Thank you for joining us today. I'm looking forward to hearing from our fearless leader, Trisha O'Keefe, currently serving as our Chamber Board Chair. I've thoroughly enjoyed and appreciated working with her this past year and a half, and time flies. But I'm really looking forward to hearing her story leading through a crisis with COVID. We know that the crisis has somewhat abated, but there is, of course, always a threat of a second wave in the fall, which we certainly hope will not occur, but unfortunately, that is a possibility. Trish is currently in her role as the president of Morristown Medical Center, an active member of our business cabinet. And I serve in my role as the president of the chamber on the advisory board, community advisory board for the medical center. And it's been really extraordinary, as I'm sure Paul can attest to it when he was in this role, to really learn all that they're doing, the constant improvements that they're making, the health and safety standards, all of the incredible awards and rankings that they've achieved. And of course, all with the mission of serving our community better and being a regional, if not a national now, resource for people who are in need of healthcare. So we thank her for being with us today. I'm not sure if Jack is on yet. Jack, are you on? Yeah, there's Jack. Do you want to say a few words?
No, Megan, that was a great introduction, and I just think I'm just really looking forward to hearing what Trish has to say, because I've been fascinated as I thought about what she was doing throughout this. I've been both fascinated as well as concerned for her, right, given all that she's been dealing with. So I think this is kind of would be a nice time for Trish to give us her perspective on things, as well as maybe reflect a little in terms of just what she's been through. So I'm just looking forward to this.
Wonderful. All right, thank you, Jack. So I'll turn it over to Trish. She'll give us a presentation. There's always an opportunity for Q&A. Kaylee Hilling is at the command center. So I believe, Kay, you will be muting everyone just for the presentation, and then we can open it up. We can unmute everyone for the Q&A portion. So thank you.
Yes, hold on one moment while I take care of that. So let's see. Okay. Trish, you should be able to unmute yourselves. Let's see, and Megan, let's see if we can do that.
Yes.
Okay, Megan got it. Trish, you should be seeing a pop-up that says something like the host is trying to unmute you. There we go.
Good.
Beautiful.
Great, Kaylee. Thank you, Megan, and thank you, everyone, and Jack and all. Appreciate this time and talking about our journey through our crisis, COVID-19. Jack, I was reflecting earlier, it seems like a lifetime ago when you and I, and actually BJ, were at the Chamber annual meeting, and I had that first call thinking we had our first COVID patient, right? It was thankfully not a positive patient, but boy, were we ready for a storm that was coming after that, right? So what I'd like to do is just talk about our journey, talk about the leadership, and then answer any questions that you may have. And sorry killing you with PowerPoint here, so hopefully not. Not sure why it's not advancing. Kaylee?
See.
Yep, just trying to, there we go.
There we go, okay.
Just quickly, this is my home away from home, which has been even more so over the past couple of months. This is that speaker. I'm not sure who she is, but we'll just keep things moving forward. Just to give you a sense of Atlantic Health, as Megan spoke to, and I know Paul has articulated through the past, just to give you a sense of breadth of Atlantic Health and all the different sites which presently exist. Gives you a sense of our market right now, caring for over 4.9 million people in central and northern New Jersey and 17,000 employees and over 600 sites of care throughout. our communities. Now, where I live is Morristown Medical Center, and just to give you a couple of key highlights, we have over 744 licensed beds, and that's important as I continue down our journey. We have over 36 ORs. Our emergency department sees usually over 100,000 patients per year. And we are a nationally recognized teaching hospital, which has over 200 residents. And we are very thankful for every medical resident we had over this journey over the past couple of months. And we are the official care partner of the New York Jets. So this is our campus quickly. We are 29 acres for the main campus. We also own 4 other buildings on the other side. So we are continuing to spread. Majority of the buildings on the lower half are focused on an outpatient and a long-term care perspective for us. So some of the more vital statistics, the number of employees you see, the physicians that we have in place, also caring for about 40,000 admissions per year. And I won't read each one to you, but gives you a sense of breadth and depth of our services that we have. Just highlighting, and I won't go through these, we've been recognized as the #1 hospital in the state of New Jersey the last 2 years by U.S. News and World Report, and we'll send out the presentation for you to take a look at the others. But most importantly was where our journey has been, which started a couple of months ago. So what our #1 priority, as all healthcare systems have been, is to ensure that we keep our patients, our team members, and our communities safe, right? Which was quite a challenge, particularly over the past couple of months, but I believe we did so in so many ways. So, I'm sorry, I keep having technical problems here. Just a reminder, again, in December of 2019, China's reporting of an acute respiratory illness, as we all know to date, was COVID-19. January, we started preparing as a country. World Health Organization declared it a public health emergency, and the first death was noted in February of this year in Santa Clara, the first COVID death. We started at that time working on our training, working on knowing it was a respiratory illness and how do we care from an infection prevention perspective, and also took our critical teams to a simulation lab and started really simulating the care of a COVID patient for what we knew, particularly from University of Washington at that time. And then, as you know, in March, WHO declared it a global pandemic, and the state of New Jersey started shutting down, very appropriately so. Part of that shutdown included our hospitals, such as elective surgeries and procedures. And just to give you a sense of that, we probably have over 200 to 300 elective surgeries and procedures a day. So that is very impactful of finances later on, which we'll talk about. But what our intent was a planned approach. We were very concerned what we were seeing in the media out in Washington, but particularly in New York City, which was the hot spot, which we know, was that the portrayal was of chaos, of confusion. And our intent was not to portray that, to make sure we had an organized, calm, collaborative effort. It can, and it was chaotic at some points, but we did not want that public facing. If we had a tough time, we went into a room and we figured it out together, and we had our calm, compassionate front moving forward. It was very much a team approach, and we knew it was going to be a marathon, definitely not a sprint by the numbers we were seeing coming out. And again, our first patient we received was on March 5th. So how our approach is how our approach is in healthcare in general. It is a team sport, healthcare, and that's one thing we're used to, high-fiving each other, supporting each other, which was actually one of the challenges that we had. We're a very, and can be very, a touchy kind of group. We couldn't high-five, right, any longer if we had successes, but that was some of the impactful efforts we needed to think about for our team members. We thankfully had a new chief medical officer who just came on board 1 month before. Our benefit was his expertise. He had worked at University of Maryland, which is shock trauma. Many of you may know that. His expertise was in infection prevention as well as critical care. So how lucky and fortunate were we to have him start the month before. our CNO teams and our nursing staff and respiratory staff, many of you know that team. Actually, Beverly is sitting in here with me right now. It was really around the clock, 24/7. We created a war room concept available around the clock. The intent of that room was to focus on staffing, supplies, stuff, which is really our resources, and to have command and communication. We are a trauma center, which you know, but this was unlike any other trauma that we've ever dealt with before. But we also knew that because it was a marathon, we needed to support each other, relax with each other, and part of our daily conversation was, what's the humor of the day, just to calm each other down because of the stress that we were living in. And I'll share with you offline some of those great humor board efforts in the future. So communication was critical. As you saw what our numbers are, over 7,000 employees we have here, over 1,700 physicians, over 1,000 volunteers. So communication was essential as to what was going on every day, because things were changing every day. How we were caring for the patient, how we were caring for the community. CDC regulations were changing every other day, and we needed to respond to that. So we were optimizing every type of meeting concept, Zoom, Teams, every option that we had, but we knew our presence and communication was so critical to keep our internal, but also our external community calm and knowledgeable as best that we could. Also at the state level, they split the state up into 3 regions, North, Central, and South. We were located in the northern region. So what that enabled us to do was to share our best practice, frankly, of the day, and to share our resources, to share our knowledge of that particular week between each region, but then share it with the state. We also had lessons learned from University of Washington, and I have to tell you, they shared every policy, every practice that they came upon nationally, and that is so unusual for healthcare because we can be very competitive. But then also on a state level, it was a daily conversation between myself and the president of Hackensack. How are you doing? What lessons have you learned from visitor restrictions, screening your staff? So really, gloves were truly off, and we were very supportive and working very closely with each other. The visitor policy was a real challenge. It was an executive order, and we truly supported that and understand the reasoning why. But you think about when you have 500 to 700 patients without seeing a loved one next to them, which truly calms them when they're in a stressful situation, really our staff became the patient's family, an extension of, and we'll talk a little bit about that. So these are the 4 key areas that we looked at, and Louis Rubinson, as I said, really supported us in these 4 areas of our phased approach. And we actually went up to a phase 31, which we were as of yesterday. We still are caring for COVID patients right now, but it's less than 1%. We now have only 10 COVID-related patients in the hospital, and we'll talk about where we were. Our highest day of COVID was 315 COVID patients. We were ready to care for over 400, but as you see, that was touching that capacity level. We converted from 2 critical care COVID beds to 9 critical care COVID pods. So that supported over 200 critical care patients and over 11 COVID medical units the other. So we transformed this entire hospital to be COVID ready. Many of you have seen our Gagnon Heart Hospital. That entire building converted into a COVID ready hospital. We also extended from our emergency department. Patients were scared to come into our emergency department, so we extended and added a tent, which OEM from the county supported us. We were able to test and treat patients and send home when appropriate, but if they needed to come into the hospital, we would then bring them into our emergency department. Again, we transformed hundreds of rooms to negative pressure, which that's the type of infection prevention or isolation that you use for aerosolizing types of illnesses. We thankfully, with Gagnon, which Paul certainly knows, added those 2 floors on just a month ago, previous to COVID starting. So that gave us a capacity of 72 additional beds, as well as a brand new PICU, which we ended up converting one of our pediatric units to an adult pediatric unit. So with all the ambiance of a pediatric unit, it was pretty amazing seeing those adults sitting in those rooms, but we needed to do it. We also utilized Mount Kimball, which many of you know has been up for sale for many years, and that really converted to a comfort unit. We knew as this disease was grabbing hold that we were going to have end-of-life conditions and needed to support that patients and the families. So it really turned into a comfort palliative care unit. So where were we with our staffing? Our staffing transitioned very quickly from working into an outpatient, which are hundreds, to bringing them into our hospital and converting them into critical care nurses on the fly. We converted them and worked as a team approach. So you had one critical care nurse and a non-critical care nurse caring for over 8 to 10 patients each. We needed to stretch our resources because we knew as the numbers were coming in rapid and furiously, particularly into March, into April, we needed to be able to not go on diversion and care for every patient in our community. We also needed to support our staff. Again, it was a marathon. They were very resilient, but they were also dealing with many pressures of their own home. They were afraid to go home. They were afraid to see their family members. They were afraid of what they were potentially spreading. So we offered from a resilient standpoint, whether it was web connections, whether it was one-on-ones for spiritual support as well too. We had patients dying, understandably so, based on this horrible disease. Majority of those patients were had comorbid conditions. Some were elderly, and I don't need to tell this group what the challenge was in regards to long-term care facilities and what we saw in our market, which was extremely sad and extremely unfortunate. So they were some of the key areas from the staff. So one quick story I'd like to share with you as well as was a resident in our emergency department. 80-year-old gentleman came in. We knew it was critical. We knew it was the end of his life. He did not have any family members with him. The resident picked up his phone and called his daughter and told her about his dad or her dad's end of life shortly. She then asked if the resident would call 8 other family members and let them all say goodbye to this gentleman. So the resident stayed with the gentleman who was passing. He also spoke to each one of those family members, held the phone up to his ear, and stayed with him as he passed away. They also had played during his transition Amazing Grace in the background. That's just one example of such resilient, committed staff. It was just amazing to hear. I did receive a letter from the daughter who the resident had spoken to and numerous other letters, but just to be so proud of our healthcare workers that we have here at Morristown, and I'm sure many, many examples across the state. We also did clap outs as well when we've had patients who were on ventilators for months, never thinking they were going to go home, finally ending up going home. So you would see hundreds of people outside celebrating with that person being able to go home or go to the next level of care. One other area was that when our patients were discharged, who was a COVID patient, we decided to play a great song, which is Here Comes the Sun. And if you listen to those words, they were transitioning to their life at home or to their life in long-term care, and has really become a mantra for us here, and many other hospitals have used this song as well too, but it was really truly the patient's road to recovery. Just an example of what some of the song is and some of the handouts that we had given. So where our areas of concern were with PPE and supplies, part of being a system and our bargaining power is our negotiations with our vendors, right? So our chief financial officer was spending 24/7 trying to make sure we had the right PPE, the available PPE. The CDC, as I said, recommendations were changing daily and getting more strict. So the type of masks or gowns you needed to use was of need in regards to what our inventory was. We were waiting for the state. We were also waiting for our vendors to deliver. Many times what they delivered was 50% of what we were expecting. The state also was slow in evolving. We understand the complexity of it, but getting ventilators to our backyard, and our backyard, it means other hospitals as well too, took a great deal of time. And there were very critical moments at that point that we were concerned, did we have enough? Do we have enough ventilators? So as we move forward in our debriefing, we do have enough, and we will have enough, and not depend on any other entity for that support, because many lessons learned, right, in critical situations. We also look to at our pharmacy groups too, redistributing of our pharmaceuticals throughout. We started clinical trials as quickly as a day. Clinical trials, as many of you know, could take months to get on board, but our community deserved those clinical trial options, and we still have eight moving forward. And also the expense from a disposable standpoint, suction equipment, ventilator supplies, which usually may cost $1 per each, were accelerated to an $8 and $10 cost. And then you multiply that in the tens of thousands. So it is quite an expense. We also found out that every hospital in the state of New Jersey had the same vendor in China, the 1-800 number, who had the same cost. It was unbelievable, and it all ended up to be a fake situation. So a lot of lessons learned from the supply side, clearly, as we move forward with this. But some great innovation has occurred. We were bundling our care because gowning to go into a COVID room took a great deal of time. So we needed to make sure that the staff were prepared, protected, but also when they were in there, giving the care that the patient needed. Options such as different types of very elongated tubing to give the medication that the nurse wouldn't have to go into the room every 15 minutes, which some of our patients needed medication every 15 minutes to keep them alive. We also looked at reprocessing, use of ultraviolet light, which we've now reprocessed over 30,000 N95. So you think about that, if we did not have those reprocessed N95 masks, we would use something suboptimal for our staff. And thankfully, we did not get to that situation. I do want to express my appreciation to BJ and his team. PwC had donated one of the machines, which you see on the bottom left-hand side, to enable us to continue our reprocessing. So big shout out, BJ. Thank you so much for your support, and many other examples of support throughout the community as well. We also had iPads in actually every room. You know, as I spoke about earlier, you know, healthcare is definitely a team sport, and many of our patients are scared. They need that contact like we all do, right? So we had iPads and using Zoom for each one of our patients, those that could communicate with their loved ones. If they could not, we would set it up for the family and communicate for that patient. So keeping that connection was so important. And we still continue with our Zoom and our iPads in our rooms as well too. So quickly, from a system standpoint, you know, we talked about a large portion of these components. Thankfully, Brian Granulotti was on the governor's task force. They were having daily discussions, again, on policy and process throughout the state. Our local officials and many of our county officials were always connecting with us on a daily basis. Our Morris County OEM is outstanding. Jeff Paul, the Sheriff's Office, supported us daily on in every way. Also a call center, as we discussed, our community was scared. We were all scared, right, as this was evolving, and we did not have enough information, or the information was changing daily. We set up a call center at corporate, which has handled over 8,000 calls in regards to COVID. Those calls initially were coming into the hospital, which we understand and needed to respond to, but think about the time that it would have taken to care and answer all those 8,000 calls. We also looked at virtual health and e-health, which many of us are so familiar with right now. Thankfully, from the payer side, the commercial payers and Medicare has now supported e-health visits, particularly for the primary care realm, but also some specialists are also have incorporated within their practice e-visits. We also had the testing center at 475 South Street, which we were testing over 200 to 300 people daily, starting out symptomatically and now from an asymptomatic approach, as well as we all know, the County College was the site for Morris County site testing, which just closed on Friday. So other supports, I've mentioned quite a few of these. I just want to comment on a few. Just the County College of Morris, when we talk about, again, resources that were needed, when we're getting to the point of a critical number and looking at our ventilators, we were able to work with County College of Morris. They have an artificial lung. So we were able to test treatments that we did not want to test on a patient, of course, but the type of respiratory treatments, and to be able to split ventilators. You may have seen that. New York Times was commenting on it through April and May as well too. Was there an opportunity for hospitals to use one ventilator for 2 patients? It's very concerning, that process, but we had to try it because we were getting to a point, maybe we don't have enough ventilators. So thankfully, Tony and his team came down on a Saturday. Our respiratory team and our anesthesiologist tried out that process. And again, just an example of some great teamwork and community partnership. The donations which we received from the foundation was over $2 million from our community members. What we did with that money was, number one, buy iPads for sure for our patients, but also supported many of our team members who needed childcare. As you know, many of our childcares were closing, but we needed the team members to come in and work and care for the patients. So there were a couple of childcare centers that were still open, so we're using some of those funds for that. We also lived through Mother's Day, Nurses Week, and a couple of St. Patrick's Day parades that came into our hospital. And you would have thought they knew it was such the right time to come. A couple of the down days, in would come over 100 cars surrounding our hospitals, going round and around, just giving us that moral support, that keep it going, you can do it, thank you guys, was so appreciative at every level of this organization. And you add the bagpipes into that, you see not a dry eye as well too, but it was so appreciated, because we also lost some team members ourselves in-house. 2 of our team members, one was a patient transporter and one was a nursing assistant to COVID as well. So it personally touched all of us. So where are we at right now? What we know about the disease is probably a little more than we had. We do have treatments evolving, but as all of you know as well too, the symptoms were very similar to the flu. In March, the flu was still very prevalent in our community. So it was, do patients have the flu or do they have COVID? Or how long would a patient be contagious? We still don't know. We are doing the antibody testing, has started for those that have had COVID. And some uniqueness to that is we've had patients that were not symptomatic, positive for COVID, but then did not have the antibodies. So the science of this is still evolving quite rapidly. The PPE we discussed, and the testing challenges. Initially, and part of our capacity challenge was every COVID test had to go down to the Department of Health, to our state. The turnaround time of the lab in the state was averaging 3 to 5 days. So you think about the hundreds of people starting to be tested, half of them coming into the hospital, we then having to isolate them, but not getting a test result from 3 to 5 days, but ensuring that they were cared for in an isolated environment. So you think about the pressures of the resources, the pressures for the patients themselves. So thankfully the turnaround time had improved the end of March and into June, but that's always and will still be a focus from us, not just in New Jersey, but clearly from a national perspective. Other points and challenges that we were working on was supplies from a medication perspective. And again, it was hard to get that chaotic view out of people's minds. I actually spoke to a former COVID patient this morning who came in and was saying, Trish, I waited another day or two to come to the hospital. I never should have done that. But what I was seeing on the TV, I kept thinking, oh my God, what am I going into? So just an example of changing the focus of our community. Of the hospital is probably the safest place to be at that time, and now as well too. Visitor restrictions, thankfully now have been uplifted and removed by the governor, so our patients can have their loved ones one at a time at their bedside. But you think about that decrease in stress for everyone, as well as the staff as well. The skilled nursing facilities is still a major issue in the state. That's a whole presentation on itself. Clearly was brought to bear the challenges in our nursing facilities. We continue to support them and support them in any way we possibly can, but clearly a re-engineering is needed in our skilled nursing facilities. So we've looked at in our ambulatory care delivery, we're still continuing telemedicine. Our physician offices are ramping up and moving forward. We've also reached out to the community and had Facebook Lives and ongoing education to our community. As I was saying, physician practices are open for business. Please do not wait to call a physician if you have an illness or you're not feeling well. What our OEM and our ambulance squads were going into homes that people that had waited for days was a really difficult situation. So we're trying to get that message out in so many ways, whether it's online, commercials and such too, as we continue that messaging. So we're back to a new normal. As I said, we have less than 10 patients, COVID patients in-house. Today, our census is 610. So that means to us, we're back strong. Our procedural areas are full speed ahead. We're performing over 150 surgeries a day. GI procedures, all of our procedural areas are up and going again. A new normal, most definitely from an infection prevention standpoint. Also from a testing our patients before they come into the hospital perspective. And also looking at our processes. We learned a lot during this whole process and during this whole pandemic. And we are instituting a lot of those changes as well at the site and through the system. So antibody testing is going on for our employees. It's a voluntary situation. What we don't know about antibodies, if you are positive, is how long will you be positive, right? So it's, again, it's a moment in time. We continue to learn and the science, again, continues to advance. We are concerned about a plan or a surge in the fall. We are pushing about patients definitely getting their flu shots again. And we hope New Jersey is consistent with our efforts of washing our hands and masking and doing all the things we need to be doing. So, you know, we continue those messaging. And then from a financial impact, you know, will we all be the same from a business standpoint? We've discussed it so many times at our board meetings from the Chamber of Commerce. You know, from small to large businesses, we've all been impacted by COVID-19. And what will our new normal be? And will we ever get back to a normal? Our revenue was down, understandably so, by virtue of our procedures being down. It went from $100 to $150 million down. We were part of the second and third wave of the CARE Act funding, It was definitely not dollar for dollar, maybe dollar for 50 cents, if that. But we needed to also spend a great deal during this time frame too, as I discussed, from a PPE resource standpoint, adding additional physicians. We were hiring physicians from across the country and also staff because we needed that additional bench strength as people were working 24-hour days. So we're looking at our rebalancing from a financial perspective. June looks better for us. April and May, I think Joe is still having a heart attack or palpitations from it, but you know, we all know it is what it is, and we needed to do what we needed to do for our community and such. So this just is an example of our, we'll move that forward quickly, and our advertising. So if you're down the shore, I'm very proud that we're going to have this hanging up on one of the tow planes, hopefully not the one that went into the ocean the other day. I was like, but just continuing to advertise, we'll continue in that vein. But just very proud to be part of our community, internal and externally. I think we all handled it resiliently and supportively, and just thankful for our partnership in the chamber in general. Just the hope you're hanging in there texts from everyone was so reassuring and very thoughtful. So that's a very quick overview of what our journey was about, and continues to be during COVID. And I'll turn it back to you, Megan, to answer any questions, and hopefully that met what we were thinking about.
Wonderful, Trish. Well, thank you for all of that. It's quite impressive. Perhaps you could share a little bit with us before I turn it over to everyone else, how you took care of yourself during this time. You must have had sleepless nights, and you know, going into it. I mean, I've listened to quite a few leading through crisis, turbulent times, and you know, a lot of the CEOs talked about things that they had to do, kind of life hacks, if you will, to make it through this. So,
Yeah.
what did you do?
Yeah, you know, it is very much about the team. When you saw myself or one of our other team members, you know, looking very darn tired, it's like, you got to go home. You just go home, relax, sleep for 24 hours, and then come back. You know, it was keeping each other in check all the time, which was so important, right? And I think we all gained a COVID-19. We're kidding about the amount of pizza and food that were coming in. You know, it was you picture this in front of the hospital, hundreds of pizzas being delivered on a daily basis, which you would, you know, be eating on the fly. So I'm back to some kind of exercise regime. I promise you that. But that, you know, it was really, Meg, to your point, just trying to keep each other in check. You know, you didn't know how tired you were sometimes until somebody would check on you and say, look, you're looking tired. We need you healthy and relaxed. And the first couple weeks were probably probably the first couple weeks into the first week in April. People were here probably 12-hour days and then some, 7 days a week. But then when things started plateauing, that's when we started really rotating everybody out and getting refreshed people coming in. But we used everyone. We had our chairman working in our war room, people that never worked in war rooms before being there. So anyway.
Great, thank you. So Kay, why don't you unmute everyone, and we can, we have about 20 people. So is everyone unmuted?
I would advise not to mass unmute everyone just in case of background noise, but people are able to unmute themselves if they have a question.
Great. Okay. So please unmute yourself and ask away.
Hi guys, this is Susan Roos. Can you hear me?
Yes.
I
Hi, Susan.
successfully unmuted. So Trish, I don't know if you saw my post in the chat, but it's just humbling to hear you talk about this, right? I mean, you know, the rest of us watched it from our computers and our TVs. Fortunately for me, you know, that was the extent of it, but it really is just amazing. So thank you. Curious whether two pieces of this question about what's going on now in the rest of the country. How are we sharing both our knowledge and are these poor people who've been working so hard now being asked to get on planes and head to Florida, Dallas, Arizona, or Florida, Texas, and Arizona to help others?
Yeah, yeah. I think from the sharing standpoint, the medical community can be very sharing, and we've been sending our best practices to them, talking to them on the phone, whether it's informally or formally, kind of our lessons learned. I think the shutdown that we had really started our curve heading in the right direction. Hopefully they're going to be doing that. And I know that's so impactful of so many ways, but clearly ours is a great example of things heading in a right direction and not going to that critical point. I believe from the medical management standpoint, we have a better sense of what can control or treat as best that you can, and just getting the patients to the physicians as quickly as possible. Hopefully that message is getting out throughout the country. As far as those getting on the plane, as we all saw what happened in New York City, like there were a lot of people that came in from the National Guard perspective. I'm sure they are in that area. We in Northern region also had in Sea Caucus, right, over 900 bed support, again, by the National Guard and the Army Reserve component. So hopefully, I'm sure they're heading in that direction too. But yeah, it's sad to see what's going on in other parts right now. Yeah.
Thank you.
Sure. Thank you.
Hey, Trish, this is Jack. Listening to the last 30 or 40 minutes, right? I mean, it just is overwhelming. I just, again, want to say thank you and congratulate you for what you guys did. But one question I have is the people I know, in the medical community have said the physical exhaustion is one thing, but the mental exhaustion was something that they had never, ever experienced. And they were concerned about, the longer term effects of that. Do you see that? Or do you think now that things are kind of getting back to normal, that it's people are dealing with it, or do you see a longer issue?
Yeah, no, definitely, Jack. Yeah, we are seeing some post-traumatic stress, really, right? With the patients as well as our clinical members as well too. So that's why we've been really upping the game on the behavioral health side. A lot of it is e-health, just by virtue of the social distancing piece. But yeah, I am concerned about that as well too. Definitely seeing that. We were saying how different it is. You can compartmentalize when you're caring for a patient who's really sick. You give 110%, but then you can always go home and debrief or, de-stress, right? Here, when you went home, you're like, oh my God, am I bringing it home to my family member? So I think that's some of the different, the nuances or just the different time with this disease.
Anyone else?
Trish, it's BJ.
Hey,
Can you hear me?
Yes,
Hi.
yes, thanks.
So I'll just pile on and say thank you as well. And hey, you didn't need to give us a shout out. If we could have done more, we would have. And I'm glad we were able to help. So I have two questions for you, Trish. One, I just wanted to make sure I understood something you said that maybe was a little nuanced, and I want to just make sure I heard it correctly. Mm-hmm. And that is it possible that someone that had the virus does not have the antibodies? Okay, so I was just curious, maybe I misunderstood something you said. And then the second question I have is around this whole resurgence of cases. And, people that I've spoken to that are following this very closely have said you really need to focus on the death rates as much as you're focusing on the positive cases. Now, that's not to diminish the reason to be, responsible and socially distant and all the other good things that are keeping us under control. But the death rates are showing a decline, notwithstanding some of the spikes in new cases. So I just was curious of your perspective on that as well. So maybe the antibodies and then the death rates?
Sure, sure. So this morning I was speaking to my chief medical officer and head of infection control. So what they're seeing in some cases was that a patient was asymptomatic, but was positive for COVID. So maybe a carrier, right? Positive for COVID, asymptomatic, then was tested for antibodies and was negative. So just a nuance to the testing protocol component. So they're not sure about that because we've been testing a great deal over here. So it's clearly a nuance there, not sure. So even with antibodies in general, you know, again, it's a moment in time, just like COVID wasn't a moment in time if you're positive or negative. So the piece in regards to the death rates, yes, it's critical to keep an eye on the death rates, but we also looked on the age group. We were seeing initially that it was over the age of 70 with comorbid conditions, right, which had a high mortality rate. Ours, in many hospitals, were sitting about 50%. Thankfully, we were sitting about the 30%. Majority of our COVID patients were from 50 to 70, which was interesting. So a different cohort than others were seeing as well too. So yeah, I'm very curious to follow what's going on nationally as things transition. Beach, I'm not sure. We're not done with this yet.
Yeah, thank you.
Yeah,
You, Trish.
sure.
Hey, Trish, it's Paul.
Paul.
Just kind of leaves you speechless to think about the commitment of your team to this and the whole aspect of not only performing in the workplace, but then the concern about going home, to me, is so huge. So congratulations on everything you've done. My question is about the supply chain. It was interesting, I think, for a lot of people to wake up during this thing to find out that, gee, we really rely on India and China for all of our generics. And as you mentioned, all these hospitals will look into one supplier in China for a particular product. So are you guys going to do an A through Z look at everything you purchase and where it comes from, or are you going to just deal with things that popped up that were significant in this whole process?
Yeah, and you know Kevin Lenahan, Paul, so you can imagine, you know, he's full speed ahead looking at A to Z and where we purchase from and making sure we have our own stockpile, you know, looking at the highest number we ever had and doubling it. Because again, we are concerned about the fall surge and, you know, as we see what's going on nationally. So yes, we're not going to be dependent on others and making sure we use the manufacturing close to chest here. I mean, the ventilators as well too. Lord, that was you know, again, a scary time.
Great. Anyone else? Okay, well, Trish, thank you so much for being with us today. We know you're a busy lady and we appreciate your leadership, and hopefully we will not see a surge this fall, but we know that we're in good hands if we do. Do you have any parting thoughts on how we can take care of ourselves and our families? Or
yeah, sure. Thank you for letting me share our story. You know, it's important to hear the story as well too, and some lessons learned. You know, I think it does get back to basics, right? Washing our hands, keeping our distance, wearing our masks, and continuing to go and live our lives, which we need to. And, you know, our businesses are challenged right now, right? And how do we continue to support them all and get the healthcare when you need it? So it's my parting thoughts.
Great. Thank you so much. Well, we know public health is economic health, right? So we need,
very true.
We need all of us to be healthy, and our employees. And so thank you all for what you're doing in your businesses and communities and supporting those in need right now, especially. So hopefully we'll get through this even stronger. Before we go, I just wanted to let you know, Jack and I have been talking about future business cabinet events. Right now, we don't have any in person on the horizon. Certainly fingers crossed for that sooner rather than later. But we will continue to have virtual events, and we also, of course, would love for you to join us in our executive council program, which you've heard me talk about before as well. So if you haven't heard from Ken or myself, you will be shortly, and we look forward to having your companies participate. We have quite a few signed up already. So we're looking to kick that off in mid to late July at this point. So Jack, do you have any closing thoughts?
No, Trish, this was exactly what I hoped for. And I did remember the look in your face at the table at the annual meeting. I'm not exactly sure what you said, but it was like, oh no, here we go. Something like that.
Yeah.
And again, just thinking what you went through, but now actually listening to it. I just want to say thank you. I mean, for the community, we're just very lucky. Thank you.
Thank you, Jack. Thank you all.
Absolutely. All right. Thank you, everyone. Have a wonderful rest of your afternoon and a happy 4th of July.
Thank you.
Thanks, Megan.
Thank you, you too.
All right. Take care.
Bye-bye.
Bye.
Thanks, everyone.
Bye.